We had just found out a couple days before the surgery that my wife was pregnant with our second kid. I was like, is this going to kill me? Is this something that we're going to be able to treat effectively? My name is Ian. I was diagnosed with stage 3C colon cancer toward the end of 2022. It was honestly rather minimal. Like, I felt perhaps more fatigued than normal. In the months leading up to that, I had done my annual physical in October, and there were just like a couple of values that were maybe a little out of whack. And that was the first time in my life that I'd had anything even remotely off. The fatigue itself was, looking back, like hindsight bias and all that, I guess like it was probably a few months ahead of the diagnosis, but I've always worked full time. At that time I had one kid, and like I'm a busy, relatively active person. So like the fatigue was a little more than normal, but I didn't really feel that. When I look back on it, I know my wife told me that she noticed that there were like a few times, especially getting closer to the moment of diagnosis, when I would at the end of the week on a Friday, like crash at 9 p.m. when I'm normally up until like midnight or 1 a.m. and like sleep until, 10 or 11 the next morning, which is just uncharacteristic of me because normally I'm like a, 6-7 hour a night kind of person. And then the blood in the stool appeared late November, like right after Thanksgiving time of 2022. I have a very concerned wife, and my sister's a doctor. I think she was still in med school at the time, but she knew enough to know like this is something that you don't take lightly. So like, I think I had the two of them telling me like, get yourself to the ER, like get this figured out as quickly as possible. And so the blood in the stool maybe lasted 2-3 days max before I went to the ER. So I went to the local ER, reporting blood in the stool. That was the main concerning thing. And the first thing they did was a CT scan. They found a mass in the CT scan. So the ER doctor that I happened to get was fantastic because he really pushed, for me to kind of like, not give up and like push to get the colonoscopy there in the ER and everything. So he was really great as far as that. And he came back and told me like, you have, after the CT. So they confirmed the blood. They did a CT. The CT showed a mass. I think it was described as a narrowing in the colon. Through all this, I was thinking about my father's history of colon cancer. The ironic part is I was 38. My dad had had rectal cancer at 48. So I was about to get my like 10 years younger colonoscopy anyway. It would have been like a routine thing. I would have done it maybe like 6 to 8 weeks after the symptoms started. So thinking about all of that and, the narrowing that was there and everything, it was like, yeah, I need to get this colonoscopy in-house. And the ER doctor totally pushed for that. The hospital GI doctor came to talk to me, and he did not want me to do the colonoscopy there. He wanted to send me home to wait and find a way to get a routine one scheduled. And I didn't play nice. So he was like, he didn't fight more. He said, okay. So I didn't even get admitted. They didn't have a room. It was a really busy time, I guess. So I did the colonoscopy prep in the ER ward, which did not have a private bathroom in my room. So I had to I was like running down the hall to the shared bathroom, hoping it was open to go through all that. It was, really, I'll never forget it. Awful, awful night. And the next morning was a Monday morning. It was real early. They first thing in the morning did the colonoscopy. And when I woke up, it wasn't even the GI doctor that was there. It was the surgical consult. It was the PA for the surgeon who ultimately became my colorectal surgeon. And she was amazing. My colorectal surgeon was amazing as well. She told me, look, there is a mass. We can't definitively confirm that it's cancer until pathology comes back. But regardless of whether it's cancerous or not, we need to remove it. So the treatment's going to be the same. So hang tight. We'll come back to you with the surgeon later today, and we'll talk about that. Ultimately, I didn't get the final definitive diagnosis of, stage 3C colon cancer until I got the pathology back after the surgery. but we knew it was cancer, even if they didn't know from the colonoscopy definitively. Like they said, it looks like a cancerous tumor and it's behaving like one, so we need to get it out. And then I got that final diagnosis after the surgery. When I was initially diagnosed, I was just kind of like, okay, let's move, let's do what we got to do. Like I'm scared. We had just found out a couple days before the surgery that my wife was pregnant with our second kid, so of course, there was a lot of uncertainty. I was like, is this going to kill me? Is this something that we're going to be able to treat effectively to the point of, like cure, long-term, remission or whatever it may be? Or is this something that I'm going to be dealing with for the rest of my life, which may now not be as long as I expected? And, with a new baby on the way, that was maybe especially scary to me. But I still felt good. Like I felt like, we're catching this early and hopefully everything's going to go really well. Yeah, I think a personality match is really important. Of course, anybody should do their like due diligence and figure out, like, is this person accomplished? Like, do they keep their patients alive? Like, do they get good outcomes and everything like that? Are they up to date on all of the important new advances in relevant medicine to whatever situation, for whatever type of cancer? But like, the personality match is really important too. Like I don't know. I don't think anybody really wants to go to an oncologist and feel like, oh, I'm dreading seeing that jerk. At least he's keeping me alive or something like that. So yeah, somebody who cares and listens and is, has those characteristics, I think is really important. In addition to, of course, I mentioned like I can be kind of a very curious person. So I'd certainly like educated myself well about different types of testing and things like that I would want to have. And so having my doctor be on board with those things, like in my specific situation, like ctDNA testing is pretty important because it's really sensitive compared to other blood work for detecting any residual cancer. And he was all about that. So, if he hadn't been all about that, I would have been pushing for it. But I think we had a lot of very similar priorities, about maintaining quality of life and doing sensitive testing and everything else. Nothing's ever like a totally straight path. So the tumor that I had was located in the sigmoid colon, which is like the last part of the colon before the rectum. And so it was not rectal cancer, which has a very different treatment protocol in general. The surgery it was robotic laparoscopic surgery. He told me that I wouldn't be back to normal for about 6 weeks, possibly. I was extremely fortunate. Like I had the normal, pain of like the gas from laparoscopic surgery, but like he used really modern protocols for recovery after the surgery. So I was eating quickly. I was up walking within a few hours after the surgery. I was like, I'm a stubborn pain in the butt, so I was doing stairs the next day, like because I think they had like maybe a physical therapist or somebody come to see how I was doing with my movement. And I told him I had stairs in my house, and he was like, "We can try the stairs here." I was like, "Let's do it." Like I went home 2 days after the surgery. The pathology from the surgery came, and that's when they had identified that multiple of the removed lymph nodes did have tumor present. That was what ended up with the stage 3C. In fact, it was maybe like 6 p.m. on a Friday night. I just looked in the portal and I saw it, and I started like frantically sending messages in the portal to the PA. From there, I ended up meeting with the oncologist. Stage 3 cases of colon cancer. It would either probably be FOLFOX or CAPOX as the chemo, and I knew basically about like the efficacies over different amounts of time. I was reasonably sure that they would be telling me 6 months based on 3C. Like I think the lower stage threes can have 3 months of chemo, but I pretty much knew it was going to be 6 that they would suggest for me. And it was. The oncologist actually, he basically said over 6 months, there's no significant difference in efficacy. So he felt comfortable going with either one. So what I was thinking was I wanted to continue working. And I had a feeling that FOLFOX would work better for that. I had the idea that I would get connected on a Wednesday and get disconnected on a Friday, and then hopefully ride out the really bad symptoms after, or side effects or whatever, after being disconnected over the weekend, and then kind of be ready to go again by the following week. So he said, that's fine. I'm totally on board with that. We also talked a lot about the possibility of neuropathy. And that was the trial that they put me in. That first day, I think I signed the paperwork to get into the trial. So the hope was I would get into the trial, and what I learned once I started the trial was that there are additional side effects to taking drugs like that. Despite taking the medicine, I did start to develop a little bit of neuropathy, and because of that, we were able to drop the oxaliplatin from my chemo regimen about halfway through. We had some good evidence that that I probably didn't have any remaining cancer in my system. So that was why we felt comfortable, my oncologist and me, dropping that drug from the treatment plan. And once we dropped that, the chemo itself was a little bit easier to manage. The side effects of just the one chemo drug were not as bad as the two. And the neuropathy slowly went away. And I would say by now, I don't really have neuropathy. If you can get into a trial that is going to mitigate the bad effects of the other treatment, absolutely do it. The worst that could happen is it doesn't really help you. And, hopefully the treatment still works as far as, treating the cancer. But if on the off chance that it will help, totally worth it. I mean, I felt more hopeful about being around as my second kid was born, and like watching him grow up and all that. And so it was a good feeling. I think we didn't maybe define that my NED time or my NED moment was from surgery until after all of that. But when I had a few more negative ctDNA tests and a few more clear scans down the line, I think that's when my oncologist said that he felt comfortable saying that I've been basically NED since that December 13th of 2022. The simple answer is I just want to make the very best of it that I can. That means, being a really active husband and father. I think I mentioned before we were recording that in addition to the second baby that my wife was pregnant with when I was going through treatment, we have a surprise third post-cancer baby. So being a really active father is super important to me. I've always loved my work and taken it seriously, but I've been maybe more motivated, kind of pushing, taking on more initiatives at work that maybe I wouldn't have before to kind of have more of an impact. I think those kinds of things have been more meaningful to me because I guess it just made me really wax philosophical about how short time on this earth can be and how nothing is really totally guaranteed. I also try to remain active in cancer communities, and if I see somebody who is newly diagnosed and I can provide some advice or some information that I might have wished that I had early on, I think that's just a small thing that I can do to hopefully help other people who are going through something similar. Do everything you can, learn everything you can, be a pain in the butt, and that is your best chance to get the best possible outcome for whatever your situation is. Cancer is terrifying. There's no guarantee of success, but I think, be a pain in the butt. Make sure that you're the squeaky wheel, and make sure that you know about what you're going to be going through as far as treatment and everything like that, because that will put you in the best possible position to get the best successful outcome, whatever that may be. Don't let people slow down your diagnosis or your treatment. I mentioned earlier in the interview, I refused to go home and wait for the colonoscopy, which might have been for me the difference between my stage 3C diagnosis or possibly a stage 4 diagnosis if I'd waited a month or 2 months to get a colonoscopy at home. Get things on the time frame you want as fast as possible. It's so important, and it's with cancer, we're fighting for our lives. We're fighting to survive and hopefully reach long-term lasting remission.